Hello, teacher. I'm Carlos Bravo, and now I'm going to explain you how to overcoming phobias. What are the symptoms of a phobia? And we have here three kind of symptoms: physical symptoms, psychological symptoms, and behavioral symptoms. Physical symptoms is related to the human body reactions, and psychological symptoms related to the thinkings that the patient or the client presents during remember a phobia, experiment a phobia. And behavioral symptoms is the behavior that the person developed during this kind of problem. And we have here usual symptoms. This is a summary of the all kind of symptoms that I mentioned before. It's a mix, I think. And we have here discontent and disproportionate thoughts to the stimulus, sweating, abnormal perspiration or abnormal breathing, acceleration of the heartbeat, and tremors and chills. When the patients present these symptoms, it's because that person have a phobia or maybe a relation with the physical symptoms or all symptoms that I mentioned. And another question say, how do people develop certain phobias? Uh, um, Follow the statistics, most phobias behind in childhood, adolescence, or adulthood because this different kind of phase of the life, you can present these possible causes. The stressful situation or traumatic event during the adolescence or adulthood because it's the most frequently that you present these kind of situations and create a phobia because this kind of people in different situations doesn't know how to solve that different problems. Could be in an accident or maybe an emergency. And the last one said imitation or a phobic family member. And this is related to during the childhood phase because the kids try to imitate the all movements up thinkings that the fathers teach during this phase. And the last question say, can people overcome their phobias? And what are some therapies for the treatment of phobias? I'm here and the phobias can be overcome with a good psychology that apply a good process for the clients or patients with the objective is try to avoid the phobia and try to create a good relationship with these kind of problems and create a solution for that patient. And for that reason, the psychology mentioned these three therapies process, psychotherapeutic treatment, psychotherapy, and medications. During this treatment, the psychology try to find the problem and create a solution in different sessions and meetings with the client and create a conversation that the patient and the psychology create a good environment with the purpose is try to find the phobia and try to avoid. And the last question say, how often do the therapies work? And this is a question that the psychology mentioned. The effectiveness of the therapy is related to the evolution of each patient. I agree with this affirmation because we have different kind of patients with different kind of phobias, and for that reason, the evolution is absolutely different. But no, it's impossible try to find the solution. That is all, teacher. Thank you for your attention.